everyone. My name is William Mulwa, a peer educator doing food science and nutrition, AJ, and I'm here to talk about adolescent pregnancy. What is adolescent pregnancy? Adolescent pregnancy, these are pregnancies that happen to young people ranging from the age of 10 to 19. These issues have been affecting the world at large, and it continues, and therefore these adolescent pregnancies not only have the risk on the young mother and the child, but also affect the child in terms of education. They tend to drop out from school, and also limitations in opportunities. So the factors that cause these adolescent pregnancies are poverty, curiosity, lack of education of reproductive health, and also social problems. So understanding of these adolescent problems is an important issue that needs to be recognized because it affects these young people. The impacts that it has on these young people are very bad. And so it is important to be aware of these same issues and the need for effective solutions. So therefore, this was just an introduction that I'm trying to give here, and then the next presenter will come and continue on the problems.
Yes, I find as well. My name is Mike Maimbo, a first year student pursuing BBA in Finance and Accounting. So, what are some of the causes of adolescent pregnancy? Of course, adolescent pregnancy is influenced by a lot of factors such as socio-economic barriers, lack of comprehensive sexual education. So, how is sexual comprehensive education affecting adolescent pregnancy? Many of the times in our communities, we find that a lot of adolescents lack the knowledge of how they can practice safe sex. That's where it comes in adolescent pregnancy. So, of course, their decisions are not made by choice, but by chance. It's because they don't know. The other factor is peer pressure. We find that a lot of young adolescents are influenced by their friends in relationships they are in. By so doing, adolescent pregnancy comes in. And this time, NBA as the next presenter comes in.
Hello everyone, my name is Captain Makasitu, a third year student doing food science and nutrition. So my job here is simple. I'm going to discuss on complications that come with pregnancy on adolescents. So the first one is anemia. So what do you understand by anemia? So this is low oxygen in the body of the pregnant adolescent. So if there is low oxygen in the body, it affects the child and the adolescent mother, leading to death. The other one is malnutrition. So if there is low nutrients in the body, or the pregnant adolescent comes from a poor background, can lead to malnutrition, affecting the child's growth. And this can also lead to premature death, where the adolescent mother will have a premature child not fully. And last one but not the least, it's hypertension. So hypertension, we all know what hypertension is. It's high force of blood against the artery. So if there is high pressure of blood, it can lead to another complication. Okay.
Hi there, my name is Vanessa Kishangatia. I student at Sagamana University. So with me, I'm going to conclude from what my friends have said in their presentation. So adolescent pregnancy is a serious issue which is anemia. We see it. So it affects your child's future education and health. And we can prevent it by proper education, support from the parents and the communities. And by doing this, we can help the young ones to make better decisions and to build their better future. Thank you for watching.